If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
The next 15 diabetic-friendly minutes that you hear on 100.7 QFM is being brought to you with the compliments of the Barbados Diabetic Eye Screening Program and the Barbados Community Foundation. A good QFM afternoon to everybody, especially if you are diabetic or pre-diabetic. This is Peter Boyce here again to tell you all about the Maria Holder Diabetes Center, located in Warren, St. Michael, right behind Eunice Gibson Polyclinic. You get to that magnificent building. Just like how Q is good for you, the Maria Holder Diabetes Center is good for you too. We know that if you are diabetic, you want to be healthy, but you're still watching your money because you know you want money left over so you could afford to go to Q in the community and dress up in all them pretty colors. That's why the Maria Holder Diabetes Center has a range of health services that allow you to stretch your dollar.
Like what services, so, boy?
There's vascular screening, so you can check to make sure you don't have bad circulation and your circulation is working properly. Then there's eye screening for diabetic retinopathy to make sure your eyes are good. This is February, the month of love. Do you love your eyes enough to make sure you get them screened this month?
You're supposed to get your eye screened every year, right?
Exactly. And there are even more services that you will hear about inside of this special segment that you can find at the Diabetes Center, including nutrition. Let us start off today focusing on breadfruit. It's lunchtime. People eating the lunch. Are you eating breadfruit right now? I know there are a lot of Bajans out there that like eating breadfruit bad. Take a listen to this phone call and you will hear what dietitian Victoria Cox has to say about diabetics who might like breadfruit. Let Alfonso here. I have a question for the nutritionist lady. Victoria, I got a question for you. I just hear all the talk about ACDs and how eating food with too much salt and sugar just lead to diabetes and high blood pressure and things. So what I just do is for a Saturday, me and the fellas just get together down by the beach and we just roast breadfruit. Some people just don't eat the breadfruit with sardine or saltfish, but not me. I eat my breadfruit plain because I does not want no ACDs in my body. But what I would like to ask nutritionist Victoria Cox is if breadfruit is either good or bad for diabetics.
So let's talk breadfruit. Breadfruit is neither good nor bad for individuals living with diabetes. They can absolutely eat and enjoy breadfruit. What I will say is that you want to recognize that it is a carbohydrate, meaning that it is one of the many foods that we are going to digest into sugar, and therefore for individuals living with diabetes, they need to be aware, just as they may be portion controlling their serving of rice or sweet potato or pasta, they also need to portion control their serving of breadfruit. You know, if we eat too large a portion of breadfruit, we run the risk of the blood sugars going too high. Just like any starchy or carbohydrate containing food, breadfruit is no different. I often like to make the joke that I have noticed that people who like breadfruit really like breadfruit, and so it's something just to be mindful of, as I say, that you don't, much like any other starch, you don't want it to be taking over the plate or the container or the portion of food that you're eating out of. You know, you want to include it in moderation and pair it with some kind of protein like fish and ideally some kind of veg or tossed salad when you have it as part of a meal.
Thanks, Victoria. So you out there listening, that is how you can eat breadfruit if you are diabetic. Remember, if you would like to call and make an appointment and get a personalized meal plan designed specially for you, just call 417-0305. Okay, let down on your feet. It is now time to focus on your beautiful feet. You need your feet to dance at you in the community and to walk about and thing. And it is important that diabetics take care of their feet. So let us hear from registered nurse at the Maria Holder Diabetes Center, Nurse Bassoon, on how she takes care of your feet when you go down there.
My name is Melissa Bassoon, and I've been a registered nurse since 2004. And I've been at the Diabetes Foundation since 2018, early 2018 March or so. A very nice experience. We do, as nurses, we do podiatry and we do the medical side of it to the extent where like that's blood pressures, taking your HbA1c, which is also a diagnosis upgraded to diagnosing with diabetes as well, and stuff like that. I really concentrate a lot on podiatry. While here, have been here, Dr. Brathwaite did invest in me alongside the podiatrists.
How important is podiatry to diabetics?
Absolutely important. Basically, is saving feet. And with saving feet, you need to get it, you see that golden era? That's that golden space. So if I can get you to assess your feet, I don't need to wait on a cut or bruise. I need to put in my education with you individually as a diabetic. So then when you start with education and home therapy and then get into the nearest hospital setting as soon as possible, you start there saving feet from that moment right forward. Yeah, it's very important. Very, very important.
What exactly is the golden moment?
The golden moment is when you get it as soon as possible. Or I home and I say, well, I can wait 3 days to see what happened. You're escalating your, I would say, damage, putting yourself out there. Don't want to go so fast to say an amputation, but you're making the ulcer or whatever worse. You feel you can get better, but that don't mean anything because you're a diabetic. Your healing process is different. We don't know if you had a tetanus injection. We don't know the severity of your controlled or uncontrolled diabetes. So we need to get everything done as soon as possible. So that's why we tell patients as soon as anything happens, just come to the nearest hospital, center, wherever, GP, public care. We have public care in Barbados. So Winston Scott, we have the tertiary institution, QEH, the Diabetes Foundation. Come on, don't waste no time.
So you heard from Nurse Bassoon. Don't waste no time. Head to the Maria Holder Diabetes Center as we go into our Q song of the day. This is Blood with Me Foot on Fire. Remember, if your feet is on fire, you should take them to the Maria Holder Diabetes Center.
The Maria Holder Diabetes Center. Your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937. The Maria Holder Diabetes Center.
As the Maria Holder Diabetes Center show continues, we are going to close off this segment with a serious topic. Amputations. We asked diabetes vascular specialist Dr. Nina Yap, why is it that Barbados is known as the amputation capital of the world?
Barbados being coined the amputation capital of the world is a really difficult label for us to all of us have to hear and live with every day. I believe that came about because of some studies that were done a few years ago with the number of amputations. And when I say that, I mean amputations that are happening below the knee and above the knee. And what the public was really seeing was a number without really any explanation or delving into the reasons why it might be. there are so many reasons that someone ends up at an amputation, and unfortunately, a lot of what the public sees, and our patients tell us this every day, is that I might not really feel like the drive towards saving a leg or a foot is there. But I am, here on the backs of many surgeons and persons that I've worked with for over a decade to say that being coined the amputation capital of the world it was slightly a mislabel, and it wasn't well deserved. Admittedly, there are a number of amputations here done, but to really understand the disease of which is affecting our people, everyone would then probably maybe hopefully appreciate a little bit more what kind of beast we're against, and that is the amount of blockages that we see below the knee. Below the knee are the smallest arteries, or some of the smallest arteries in the body, and when you get down to the toes, you're talking about arteries that are less than 2 millimeters, or even smaller. So when those have blockages, there's hardly really any reversing of that. However, with the advent of medication to combat diabetes and high blood pressure and cholesterol, taking the right sort of portion of medication can help slow the progress of this disease. What I tell patients is that it can't reverse it, or it's unlikely to reverse what's already there, but it can help the progression or help getting it worse, as well as what we do here now, which is endovascular surgery or revascularization. It's really a big word in that we try to do techniques and surgeries or procedures to try to open up blockages and try to tunnel a hole through the arteries for blood flow to go down. Being coined the amputation capital of the world, I guess to answer your question directly, is a label that I refute and try to get patients ready to understand more than just coming with a label, but try to steer them towards how we're trying to change really a whole movement for peripheral arterial disease. But it is difficult, and I understand that sort of flag is in people's mind always, and it's something that we deal with every day at the hospital for sure.
We now welcome to the show a patient of the Maria Holder Diabetes Center, Miss Dacia Moore.
Thank you for having me. I have had diabetes for just about 8 years now. I got it when I was really young. I just say it impacted my life pretty big, especially going through school and stuff. It was quite difficult at times. Being in school, the children, nobody's really educated about diabetes. All everybody seems to think is that you eat too much sugar and you can't do this. Everybody thinks it's limited to like one category of things, or it would be hard to watch the other children enjoy a lot of other things that at the time I didn't know I could enjoy myself. So that was the biggest challenge for me.
What did you learn from being a patient of the Maria Holder Diabetes Center?
I learned that diabetes, don't limit yourself. It is not the end of the world, and that you can do everything a quote-unquote normal person can do, and as long as you have a good support system, you'll be okay. I utilize the diabetes specialist nurse, the podiatrist, the nutritionist. There's also a psychologist there as well, and of course the doctor. The staff there, everybody there is really nice, and they're supportive, and they help me through a lot of my problems. They taught me about calorie counting, learning how to balance my meal so that I can still enjoy the sweet things and everything else that, as I said, quote-unquote, normal people can enjoy. They help me not to be insecure about having diabetes. It's something that I have to live with, and to love myself, to be confident in everything I do.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care, and diabetic diabetic care it involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.